Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness, and I have my lovely model Nicole with me today.
Hello!
So we're going to talk about Botox because in my opinion, everybody should have Botox. I love Botox. Do you love Botox?
I love Botox. I'm ready for it.
I said, I need a model, and she's like, I need mine. So first of all, before we actually inject, I want to go through all of the different muscles and what Botox is, and just give you a really great understanding of how it works and why we use it. So let's first look at our muscles. Let me get a thing here. Okay. So how I like to show where we are going to inject is that we start with the glabella. So the FDA has actually approved three areas for injections. And so that's what I'm going to stay on label so that you can understand, you know, what the FDA has approved for indication, okay? So on label, which means that that's what their approval is they have the glabella region. So we're looking at this area right here. These two muscles squeeze together and create the 11s, or create the angry eyes, or create, something that maybe it makes you look tired. But there's a lot of different ways that people describe what's going on in that area. So these two muscles are what create the 11s, and then you have this little guy in here that actually pulls up and creates the line going across your nose. So when we're injecting the glabella region, I'll actually show you on her face because it'll be easier, is we want to inject in the procerus and then in our two corrugators, the front and the back. So you get 5 little injection spots that we are injecting for the glabella region. Now, the FDA has approved 20 units in that area. I'll tell you, this is where Botox becomes an art, because I will do different amounts for different people, but the average person in my clinic is probably more like 24 units, because most of the time people do already have the lines going in the glabella region. And if you have deeper lines, no amount of Botox is going to take it away completely. That's where skincare and other treatments come in. But the more you do Botox, the softer the lines become. So if your lines are deep, don't expect them to go away 100%, but they will soften. And over time, they will get better and better and better. So again, in the glabella region, you inject 1, 2, 3, 4, 5. And that corrugator muscle, the procerus muscle that was in here actually goes up onto the forehead. So you get a nice smoothing of the forehead about like this. So this whole area is relaxed and you can't make the movement. So for some people, that makes them uncomfortable because they can't make the movement, but you get used to it, and the majority of people really like not being able to make the movement. It helps with tension headaches. It's not indicated for headaches in the cosmetic sense, but it absolutely does help with tension headaches, and then obviously on the medical side, it can help with migraine headaches. I do not treat that. That's where a neurologist comes in. But all of our patients do say that if they are prone to headaches, that they will feel some relief, and they know when their Botox is going to wear off because their headaches will start to return. So the next area that is indicated, and I'm going to show you on our little face, that's indicated the crow's feet. So the crow's feet, we can inject in 3 different spots like that, 1, 2, 3, or 1, 2, 3. So again, it depends on the lines. And the FDA has indicated 24 units in that area, so 12 units on each side. And you know what, let me show you on her face because it will be a little bit easier. So smile big for me. So you can see the lines here. Hers are very baby lines. It's not like she needs it a lot. And when I get into treating, I'll talk about how many units I'm actually using on her, because she is less than what the FDA actually approves, because she has little baby lines and hers is more preventive. But when we inject, we can go 1, 2, 3. If she didn't have these lines up here, then I would be more like 1, 2, and 3. So what it does, let me hold that for me for a second. So what it's gonna do is relax these lines. So try to smile. So see how she doesn't have the lines there. That's really what it's going to look like when she has her Botox. It's not going to address underneath here 100%, but it will soften those lines too. But I like to tell patients when they're doing their crow's feet that sometimes you think, oh, well, those lines are a lot worse. But in reality, They're not worse. You just didn't see them before because you were seeing your lines out here and under there. So it's just something I like to point out so that patients aren't, overwhelmed going, oh my gosh, I didn't have these lines underneath my eyes. But what the beauty of the crow's feet is that you really can't tell you had anything done. Same thing with glabella, is that you just can't tell you had anything done. That's why we love Botox so much. It's one of those things that they say everyone will notice, but nobody will know. So some of the comments we get is that people look rested, that they've lost weight, they had their hair done. They don't ever really go, oh, you had Botox. They're not gonna point that out unless it's Botox gone wrong, and then maybe so. Then the next area that was indicated is the frontalis muscle. So that's this muscle right here. The fibers on these contract, and so it lifts your eyebrows up. So the FDA actually indicated 20 units in there. My personal opinion is I don't usually do 20 units on most of our patients because, especially not in the beginning, because if you relax your frontalis muscle too much, that's what flattens out your eyebrows, and that's what potentially can droop the eyebrows. So there's always a misconception that if I inject up here, it's actually gonna lift. It doesn't. If you inject up here, it's relaxing the frontalis muscle. It can actually relax the muscle so much that it may flatten out your eyebrows. So if it's done right, it should relax all the wrinkles that are going across your forehead, but it should not droop those eyebrows down. And the other thing that I forgot to mention when we do glabella is this will actually give us a little bit of lift. So if this is relaxing and this is lifting, you should be right where you started. And that's really what the purpose is. Again, it's not to change the look of the face, it's just to relax those muscles. So the art of it comes in is looking at everybody's face a little differently. So when's the last time you had Botox?
It's easily over 3 months.
Okay, so
it might be more 4.
Okay,
right now.
so it's indicated that it will last about 3 to 4 months. So we try to stay on top of it because again we're preventing,
right?
And so we don't want her lines to get any. Not that she had lines. I shouldn't say that because I'm not saying she has lines, but we don't want any lines. How about that?
I don't like movement.
Yeah, no
like
movement.
it nice and smooth.
Yes. And so if you look at people, especially in our office, if you're looking at the gals here, well, and Dr. Wise, we all have Botox, and I feel like we all look very natural. So it's not a matter of taking away all of the movement, but it's just relaxing everything so that you don't have those lines.
Yeah, I feel like I can
lines.
still have all my expressions and all my, when I talk, I can express, but I'm nice and smooth, which is what I like.
Perfect. That's exactly what I was trying to say. So good job. Okay, so furrow for me. So you do have quite a bit of movement in there.
I'm pretty much wore off at this point.
So this is perfect because she does have quite a bit of movement in there. However, it's still not a lot of movement. So I wish I had somebody who had a lot of movement so we could compare the two. But hers is great, and she actually could be a great candidate for just the 20 units that I talked about with what the FDA recommends. But we've always done just 15 units in there, so that's probably what I'm going to stick with. Not probably, I am going to stick with that. So then lift your eyebrows up. So this is great too because she does have quite a bit of movement in there. Relax. When she's not making the movement, you really don't see her lines. You can see a little bit of a remnant on there, but it's nice and soft. So lift again for me and relax. So when we're evaluating foreheads, we're looking at the size, the length, we're looking at her muscle movement, lift again. We can tell her frontalis muscle comes all the way over to here. So when like I said, when I look at all of this, that's how I'm going to determine how many units I'm going to give her. So when you're doing forehead, you need to stay above this line, and we're just going to go right across the top of her forehead, and that should relax. And this little area, remember how I said this glabella region? You can see actually her muscle beautifully right here. So she's going to get a lot of smoothing right through here. So that's why we'll stay low on the forehead. High injecting on the forehead, but low amount of units on the forehead. And then back to her crow's feet, since her lines really aren't that bad, I usually only inject in 2 little spots on each side. So as I said, the FDA has indicated 24 units, but on her I only do 16. Now on myself, which hopefully my nurse Taylor's gonna come in here in a little bit and she's gonna inject my crow's feet, but I actually do 30 around my eyes, and I've been doing 30 for, 11 years now. And my crow's feet will last a little bit longer, but I'm always injecting a little bit because I just don't like movement either. So, are you ready?
I'm ready.
Okay. So let me get my gloves. And okay, so back to Botox can last 3 to 4 months. I usually tell people about 3. Now, as little amount as I'm doing on her, I would tell her more like 2 to 3 months. The more Botox you do, the longer it is going to last. However, we don't want to over treat so that you do have some movement. So I'm not saying let's do double the amount because we don't want that. It can take up to 2 weeks for the Botox to kick in. So I tell everybody that the average patient is 3 to 5 days. So don't expect miracles overnight. Don't expect that all your wrinkles are gonna be gone by the next day. You okay like that?
Yeah.
Okay.
If you're okay.
Yep, I'm fine. Okay, so again, in this area, I'm actually only gonna do 15 units and only 3 injection points versus the 5 injection points that I talked about earlier. Doing okay?
Mm-hmm.
Okay. Excellent. Easy enough. Now, if you look, she has little bitty bumps on there. That is normal, and those should go away within about 5 minutes. And then let's do her forehead. Just a little bit. Lift those eyebrows for me and relax. And we're doing 10 units up here, and the indicated amount that the FDA has approved is actually 20 units. Very rare do I do 20 units. Guys can get away with that. And somebody who has a very tall forehead, or somebody that is just, has a lot of movement. Okay.
How does it feel, Nicole?
It's just like a little sting, but it's such a small needle that and it's so fast that it's really not bad at all.
Smile big for me and relax. So just 2 little injection spots on either side. And I'm going to switch sides here. Smile real big and relax. Okay. Very good.
Crow's feet are not my favorite. I tend to get watery eye just because it's sensitive there.
Well,
Okay, good.
you did great.
I did, yeah.
You did great. So let's review. Glabella region is at usually 20 to 24 units. Forehead, my average is 12 to 14 units. And then our crow's feet, my average is 24 there. So when people come in and they say, they want the very minimal amount, what I did today really is the minimal amount. And so if you treat less than that, it's not going to work at all. So there's no sense in doing it if you don't treat the right amount of product. And unfortunately, the more lines we have, the more Botox we really want to do to treat that. So I'm gonna switch with Nicole.
Thank you.
And Taylor's gonna come in and do mine. So I'm gonna try not to cry because I don't like needles at all. But I usually am not too big of a baby. So we actually did I forgot that I was going to do this video today. So we actually did my glabella and my forehead earlier today, and so right now we're just going to do crow's feet. Did you see it hold up there? Okay.
Yes.
Okay. And I do 15 units here, and I think we did 10, and then I actually did a little lateral brow lift. And the reason I did that, can you see the little bit of a line? I don't know which side it's on. You see some lines. So the reason I add 2 here and 2 here is not necessarily for my lateral lift, but more to get the lower lines on that forehead, because I don't like lines either. I don't mind movement, but I just don't like to see it. This is actually the most movement I've had in a very long time, and haven't taken the time to get my Botox done. So, okay, ready? I'm ready.
All right. Smile big and relax. All right, here we go.
And this is Taylor, and she is one of our nurses, and she has, well, by now it's probably over like 275 hours of Botox training, one-on-one with me. So we have another nurse, Jill, who is also here, and I am very big on training and making sure that my nurses are 100% comfortable with procedures that they do. And so I'm fortunate enough that I get to go to other clinics and train. And I love education so much, but to hand the baton over to somebody else, I wanted to make sure that they were comfortable, but also that I was comfortable. So the good news is when you come here, if you can't get onto my schedule, I trust these girls, nurses, very much, because I allow them to do mine. And I mean, Jill's been with me close to 10 years, and I've always let her, and you've been doing mine for a good 2.5, 3 years probably.
Smile big and relax.
So I feel very comfortable with them treating. And then for crow's feet, we're doing 30 units today because it has been so long since I've had my Botox. I shouldn't say since I've had it. It's been 3 months since I've had it, but it's been a long time since we actually treated the full amount of Botox. Usually I'm just doing 5 or 10 units on each side. Well done. Good?
She did great.
No pain at all.
No pain.
That's right. So, you also do Botox.
Yes.
So, talk about your experience with Botox a little bit while we're here.
So I'm 27. I've been doing Botox since I was 24. I used to have a very deep line across my forehead and between my brows, very, very deep. So it's all gone now. So I originally did it because I started to notice that my makeup was getting stuck in those lines, and I just didn't like it. It aged me a ton. So that's how my Botox journey started, and I will never go without it.
Good. So the average age for starting Botox is actually 24 years old, and it's really for the preventive effects. It's not necessary to treat, obviously, at that age, because most people don't have lines. She did have a line across her forehead, so we were able to treat it, but most of the people coming in is more for prevention, and that's where I go a little less on the units of Botox. So the older we get, obviously we're treating. We're not just, we are preventing, because they're not getting any deeper, but we're also treating. So as I said, I love Botox. I think that it's an easy entry-level aesthetic treatment to start. I would definitely recommend going to a clinic that has a lot of experience. Somebody that has been trained by a physician at least. I mean, I have no problems with nurses injecting, nurse practitioners, PAs. I really have no problems at all as long as they're trained, and I think that's the bottom line, is that it's not just a one and done, I'm going to do a couple of units, a couple of patients here and there. It's really about going the extra mile and getting trained on it. So, okay. So the one thing that I wanted to talk about, thank you so much.
Welcome.
The one thing that I wanted to talk about besides, I've got some other things, but the one thing is our membership program. So we've been doing skincare membership for about 8 years now, and how that works is that you pay monthly for whatever skincare you choose to use. And our growth factors is the number one product that is in the skincare membership. So, oh gosh, 3-4 years ago, I had a patient say, hey, could I put away some money for my Botox? And I thought, well, sure, this is genius. And so what we've done is we've created a membership, and we determine how many units that you need, and then you pay monthly for those units. So when you come in at your 3-month or 4-month visit, your Botox is already paid off. And so it helps you budget out your beauty, it helps you budget out your Botox, and it just makes it a little bit easier to stay on track. Therefore, you have better results. Everything is better. So you actually could start, if you just wanted to do this area, you could start as low as $96 a month, which is very reasonable when you're talking about aesthetic procedures. Now, obviously, the more units you do, the higher it goes, and it's really your comfort level as to how much you want to pay monthly. So we have skincare, we have Botox. All of our services that we offer actually can be put into this membership program. So we like to give you a complete treatment plan, because as much as I love Botox, I think there's so much more than just Botox. I think you need your product at home. You need to take your product or use your product every single day. It's like brushing your teeth. I mean, you brush your teeth twice a day. So you need to use your product at home. And when I'm saying product, I'm not talking about just running out to the nearest drugstore or buying it online. That's not what I'm talking about. I'm talking about medical-based, scientifically proven products that will actually change the physiology of your skin. So our products are Skin Medica and Color Science. And the reason I use Skin Medica is that they have over 160 scientific studies. That's unheard of in the aesthetic world for skincare. And the research and development team is outstanding, and they're always getting the next best thing so that we can continue to improve. So I have a little confession to make. Lumivive is one of our products that came out, gosh, has it been a year? Close to a year probably, and it's a pretty neat product. It's a daytime serum and a nighttime serum, and I hadn't used it yet. I have extremely sensitive skin, and I was a little bit afraid to use it. So I had my training with Lumivive again last week, and I thought, why am I not using this product? And so I started it, and I absolutely love it. I actually can really tell a difference in my skin, which is so surprising that after just a week you can tell. And really what Lumivive does is it helps to make your skin glow. And the evening, this is why I loved this product, because the evening time routine actually, or the evening product actually will heal your cells. And it's very, very scientific, so I don't want to get into all of that here, but it helps to heal the cells, and it creates a better, healthier skin environment for yourself. And so I'm blown away daily by the changes that we see, not just with Botox, but with our skincare. And I can't wait to share. Some of our book models have been coming in for their final photos, and the photos are outstanding. So in the next several weeks, we'll be sharing those photos too. And some people were on a lot of product, and some people were on a little bit of product, and then some people were right in between. And it truly blows my mind how Skin Medica can change the skin. So what we typically will do is have you come in. I'm getting off track of my Botox, but what we typically do is have you come in, and we take photos, and we look at your skin underneath, and then we do a whole treatment plan. So if you want to do just Botox, that's great, but using some of the at-home treatments will help to enhance your Botox, as with any other treatment that you do in the clinic, and it will actually make it last a little longer, and your skin will just look better. Think of it if you had a facelift, yet you never did anything to the texture, the color, the tone, of your skin, and you have all these brown spots, but you do this facelift, and then you're nice and tight, but you still have all these brown spots. I always say, great, you at least didn't have the sagging skin, but you have a lot of brown spots. So you still are looking on the, I hate to say old, but on the older side. So when you're looking at aesthetics, I really recommend that you don't just do the basics, the bottom line, and don't look for the cheapest, because that is the biggest mistake. This is your face, people. Like, that is the biggest mistake you can make, is like, oh, I'm gonna get a Groupon, or I'm gonna get the cheapest Botox I could possibly find. Go to a quality clinic who has injectors who are extremely trained. okay, get off my soapbox there. But a couple other things when we're talking about around the eyes, as the Skinmatica has our TNS Eye Repair. This is very hydrating, moisturizing, and it helps to improve your fine lines and wrinkles, so that's an option. And then our Pep Up, I love Pep Up too, but our Total Eye is another thing that can help with the fine lines and wrinkles around the eye. So remember when I said when we do your Botox around here, you can still see lines underneath here. Well, this is the perfect product that will help to improve those lines. So this is the morning product, and it has a little bit of color to it. It has ingredients in there that will actually improve the fine lines and wrinkles and tighten up the skin a little bit, but the color will cover up your browns or your dark circles. I do not leave home without this product. It is in my bag. I use it every single morning, but if I have a meeting, like I had a meeting last night, I put this on before I went because it just brightens up the eyes. So this is your, oh, I forgot the most important thing, SPF 35 in this. So when we put our SPF on, we a lot of times forget to get our upper eyelids, which I wouldn't put chemicals on my upper eyelids anyway. So this one is a physical block, and you can put it right over your eyes and of course under your eyes. And so not only are you hiding your dark circles, you're fixing your dark circles, but you're also protecting from the sun. So that's the morning. And then this one is the evening, which doesn't have the color to it. It has all the other ingredients that helps with puffiness and fine lines and wrinkles, and it's just a clear. And this one feels really good. Both of them feel good. They have a metal alloy that is cold on your skin, and so when you're rubbing underneath your eyes, it just feels amazing. And then they also have the eye patches that go on twice a week, and you put those on and they will help with the fine lines and wrinkles too. And again, blown away by how these actually do improve. So when you're looking at products, the average person actually spends $2,200 on products in a year's time, and the majority of that money is just going out the window because there are no active ingredients in these. So you really need to look at products in a physician's office, in a medical office, because you're going to have the highest quality products. You're going to have the highest quality, pretty much you should, of everything. All of the treatments have been researched. The Botox, let me go back to Botox for a second. I use Botox because it's been in the US as medical for 30 years. It's been approved for aesthetics. I think it's like 12 or 14, don't quote me on that, but it's been used for aesthetics for a very long time. And it's the gold standard in my opinion. It's the product that has been around the longest, has multiple clinical studies behind it. They're always trying to get the next approval. So again, we have glabella, crow's feet, and forehead right now, but they're working on other indications with the FDA. So I say buyer beware when you're looking at the other neuromodulators that are out there. I'm not saying they're bad. I'm not saying don't use them, but what I'm saying is do your research. And I feel like the gold standard is Botox. That's my opinion. So I think to summarize our Botox, when you have it, it can take up to 2 weeks to kick in. You can do your glabella, your forehead, your crow's feet, which is indicated for the FDA. You can do other areas. It can last 3 to 4 months. If you want to budget out your Botox, our Fountain Club is an excellent option for you. If you have any other questions, just give us a call at 618-288-9117. I've been doing injectables for 11 years now. As I said, I train other clinics, other physicians, nurses, PAs, nurse practitioners, and I feel very confident that our clinic, our team will get you in get your treatment plan the way that you want it, that's budget friendly and a part of your lifestyle, because we're not going to give you something that you're not going to be able to handle. So give us a call. We would love to see you. And oh, one more thing, I forgot about our rebates. That's the whole reason I did this. So through the end of May, we have rebates for Botox. So if you've ever really wanted to try Botox, this is a great time to do it. You get $50 off your first treatment, $50 off your second treatment. Your third treatment, you pay for. However, your fourth treatment is free up to 50 units. So what was it? Buy one now, buy one later, then a buy one and then get one free. You also qualify for $100 off a filler at your third visit. So this is an excellent rebate that we can give you. And so I think that if you really feel like you want to try Botox, this is an excellent way to save some money on it. So I hope to see you soon.